So in this presentation, we're going to discuss about the Native Americans and Alaskan Indians and the impact on COVID-19. So the history of medical treatment was actually shown that the CDC noticed that several organizations actually failed to provide or consistently acknowledge data that display the outcome of both Native Americans and the Alaskan Native groups during COVID-19. And this actually resulted to a very large gap in the public health data. And actually, one of the organizations, it's called the Indian Health Service, they provided healthcare to 2.2 million tribal members out of the 18 million who were actually uninsured before COVID-19, actually had shortages of funding towards their hospitals, and it caused to have fewer doctors, nurses, and hospital beds. And this actually resulted to higher infection and death rates towards the Native American populations and the Alaskan Indian populations. And many of the hospitals actually couldn't handle the large amounts of COVID patients, so there was actually a limited supply of a lot of resources such as PPE, personal protective equipment, and ventilators. So that was actually a huge problem for the Native Americans and other minority groups as well.
The AIAN is a forgotten minority, and due to a relatively small population size, they are often lumped with other small minorities when producing health statistics. Either that, or they are just completely omitted. This misrepresentation is a structural inequity that makes it difficult to truly assess the damage done to the AIAN people from COVID-19. If we don't know how bad they're suffering, it makes it impossible for us to allocate the proper resources to help them. Compared to all other U.S. races, the AIAN people have a lower life expectancy by 5.5 years. And they also experience higher rates of chronic diseases. As a minority, they have the highest rate of diabetes. Other social vulnerability factors include crowded housing, a lack of transportation, and a low socioeconomic status. The AIAN people have all three, and they are all instrumental in COVID transmission and COVID deaths. These, among other factors, make the AIAN population especially vulnerable to the COVID-19 pandemic, while their true COVID transmission and death rates are being concealed by misrepresentation of health statistics, which is a structural inequity.
In conclusion, due to several reasons such as structural inequity, and lack to healthcare, as well as unsanitary living conditions in crowded homes, Native Americans and Alaska Natives are much more likely to spread COVID-19 among their own population. They also have more cases and mortality per capita than any other population in the U.S. In another study in Arizona, Native Americans only made up 5% of the population, but they made up 13% of the cases and 18% of the deaths. Another study showed that the infection rate for Native Americans and Alaska Natives was 3.5 times more than for the non-Hispanic white communities, and they were 1.8 times more likely to die from COVID-19 than non-Hispanic white communities. In addition, people of color in general are much more likely to not receive the same medical care that a non-Hispanic white person would